Hi, this is Lauren Shields with Fox 47 News. I'm here with Margaret Anderson, Senior Vice President and Chief of Sales and Marketing Officer for Health Alliance Plan. Hi, Margaret. How are you today?
I'm doing great. How are you?
I'm great. Thank you for asking. Let's
Good.
start by let's talk about the Health Alliance Plan. You are a Michigan-based nonprofit. What are some of the things that you do?
Certainly. So Health Alliance Plan is headquartered in Southeast Michigan. We've been an insurance plan here in Michigan for 60 years. We are actually a wholly owned subsidiary of Henry Ford Health System. So we're part of an integrated delivery system, which gives us a very different and unique view of the marketplace. We've got several different product lines. We sell to employer groups who then offer coverage to their employees. We sell to Medicare members, Medicaid members, and we also specialize in the individual membership off the exchange.
That's awesome. Thank you for sharing. So I heard there is a recent Medicare scam. Will you tell us a little bit more about that?
Certainly, it's really disappointing this year, given the fact that we're all virtual. And typically, most of the Medicare enrollment activity and presentations take place in person. You know, people really want to know and have that direct eye-to-eye contact when they're thinking about something so personal like their healthcare and their healthcare needs. So, given the COVID crisis and what we're going through with the pandemic, we've shifted and everything is now virtual. So, we aren't doing in-person meetings, in-person seminars. Everything is done online. And what that's done is it's created an opportunity for some of the national telemarketing organizations to really think about how they can leverage their tools and their technology and how they can come into the markets that they maybe traditionally wouldn't have been in and had boots on the ground and people meeting directly with seniors. And they've started these very aggressive telemarketing campaigns. And it's really too bad because what's happening is Medicare members unknowingly, I should say, are giving out very personal information over the phone, thinking that they're actually talking to a Medicare representative, when in fact, Medicare will never call you at home. They wouldn't reach out to you. So they are unfortunately getting these folks to disenroll from their current health plan and re-enroll into a new plan that the person on the phone doesn't even realize it. The consumer doesn't even realize what's happening. The really sad thing about this is that many times when these consumers make this change, their doctors aren't in network. So they lose the opportunity to see their doctors, which is really important. And oftentimes many of their drugs are not covered by these plans. We're here just really as a public advocacy message and to really deliver this important news and make sure folks know, don't give out your Medicare information. It's just like your Social Security number. So we're really here today to talk about this and what's happening in the Michigan market.
Absolutely. And I read that if a Medicare representative asks for your Medicare ID number at all, that is a giant red flag because they will not ask you that over the phone, correct?
You are absolutely right. Yes.
So what should a consumer do if they receive a call like this?
They should first ask the person their name and ask for a phone number where they can call them back, so that they can then make sure when they call, they'll notice who am I calling and who am I talking to? So wait, this isn't Medicare. This is somebody else that's calling me. So first things first, we do recommend that they don't give out any information, don't continue the call, ask for a contact name and a phone number to call back. The second thing is we really recommend that these consumers call their existing health insurer and say, did you call me? Is there some action I need to take? Our customer service lines have been inundated with people calling in saying, I think I'm confused. I think I did something wrong. I don't want to lose my HAP coverage. I don't want to have to make a change in a doctor. So there's just so much confusion. So call your health plan. They're your trusted advisor. They're here for you. So again, that's what I would recommend.
Awesome. Thank you so much for sharing. And you have several easy tips for protecting your Medicare account. Do you care to share a few?
Sure, absolutely. So our tagline is guard your card. You know, you want to make sure that you never give your Medicare number out over the telephone. It's not necessary. You do not give your health plan ID number over the phone either. In some instances, when you're talking to your doctor's office, they might ask you for your number, and that's totally fine. But when thinking about how you can protect your personal information, it's really important, one, to make sure you know who you're talking to on the other end of the phone, and two, to not give out your social security number or your Medicare number.
And Margaret, what if someone receives something in the mail that seems official for Medicare? What should they do then?
Again, read the fine print. I would really caution people, you are not going to have Medicare mailing things to your home. These are mostly telemarketing agencies that are trying to prompt you to call them or to send in a reply card, and also ask you for your Medicare card information, which we already went over is a definite no-no. So I would just be really, really thoughtful and really careful as you're looking at your mail. A lot of it is branded in the red, white, and blue. So people automatically think, oh, this is from Medicare, it's official. You would not be getting anything from Medicare. Any of your communication is going to come directly from your health insurer.
Thank you so much, Margaret, and thank you for helping to protect our community from these potential scams and frauds. So we really appreciate it.
Thank
Again,
you.
thank you. Again, this was Margaret Anderson, Senior Vice President and Chief Sales and Marketing Officer for Health Alliance Plan, and I am Lauren Shields from Fox 47 News. Thanks. Have a good one.